Okay. Well, people are still having lunch upstairs, but that's fine. Still, we can get started. It's going to be a very short session anyways, and we are just like few people here, but thank you so much for coming. So
We should move down there. Go on.
Yeah.
good idea.
Yeah, otherwise
Sure.
you'll be sort of shouting.
Did somebody advise people that you was having this
Yeah,
at lunch?
Anna's just gone to mobilise.
Oh, right, okay. So you might want to wait a minute or two.
Come down here then.
There might be more people joining, but
Okay.
yeah, they might also need a.
Okay.
So we can do it as like a brown bag session, between us. Hopefully more can join.
Okay, let's get started. So we finish by 2. Okay. So today I'm going to talk about first of all, I'm Melis Mevsimler. I joined you today from Ada Lovelace Institute. We are a London-based research institute whose mission is to ensure that data and artificial intelligence work for everyone in society. So today I'm going to talk about a 3-year-long project on COVID-19 technologies. This is precisely contact tracing apps and digital vaccine passports, which I think that probably each of us here have used at some point in the pandemic. So we have been working on understanding the societal, regulatory, and technical implications and legacies of these technologies at an international level. So, of course, this is a task difficult to do alone. So today I wanted to share the main findings and sort of like the policy recommendations that we are drawing out from that research, and like sort of here, as we are a multidisciplinary group of people here, just to hear your opinions and experiences professionally or your anecdotal experience with these technologies. So I'm just going to very briefly talk about the importance of these two technologies. Briefly, Ada's COVID technologies research since 2020. And as this is an international research project, I'm not going to go in depth, but just sort of present the cross-cutting findings and sort of like the legacy questions, which I think that as these technologies have been very important part of pandemic governance, I think this is like important that today we discuss sort of their longer term implications for public health and pandemic preparedness, and sort of also the lessons that we draw from this session. So contact tracing apps and digital vaccine passports, they are actually novel technologies. I mean, sort of like contact tracing apps, a different version were used in various African countries before in like Ebola outbreak, but they are in the main, they are new technologies. And this is like sort of a very famous quotation from Ada's director, Carl Lekine, saying that COVID-19 is the first pandemic of the algorithmic age. So data have been very important part of pandemic management. And these two technologies, digital vaccine passports and contact tracing apps, they're actually very different from other existing technologies that were used for pandemic. For example, the machine learning algorithms to profile the risk of incoming travelers or predict infected patients at high risk of developing severe symptoms. What distinguishes these two technologies is that they are public-facing technologies. So we, as members of the public, have to use them in order for them to be effective. We had to isolate if we received an alert from a contact tracing app. We had to consent sharing our personal data and health data to be able to go to workplace in some countries, to be able to travel. Almost every single country required proof of vaccination or a negative COVID-19 test from inbound travelers. So they're like really interesting technologies that test public acceptance of embedding these sensitive and powerful technologies in everyday life. So they are very different from the previous technologies that are used by public health authorities, and probably we do not even know what kind of data that goes into that and how they use it. And they were also, although they're like very sensitive technologies, they were also rolled out very fast at pace with no consensus on how to design them, how to govern them, and how to monitor and evaluate them. So this is also another thing that makes it very interesting. So we think that these two technologies are interesting for pandemic preparedness. If we had another pandemic, are we going to use these technologies or similar technologies? I mean, have we found them effective? Have we found them secure? And secondly, of course, for public health and social care provision, because probably those of us who live in the UK, we already use NHS app in some way or another. But at the same time, such like sensitive technologies, we have to think about what are their roles in public health and social care provision, and for emerging technologies, which I'm not going to go into detail today, because of course, we are focusing on the pandemic and public health, but we have quite a lot of emerging technologies in delivery of public services, education, health, of course, and identifying people who should be prioritized in getting universal credit, etc. So it is very important to understand how these sort of like the societal and technical requirements for effective data-driven technologies. So in the first 2 years of the pandemic, we precisely focused on the UK and a little bit on the Europe context, but mainly UK. And then we sort of, when we understood that the government was trying to roll out these technologies like vaccine certificates and contact tracing app, we worked with an interdisciplinary group of experts and focused on what are the ethical, societal, and technical risks and challenges of these technologies. And we actually secured a seat at the table and advised the government on the sort of the technical design of these technologies and the legislations that the UK government had to have in order to roll these out. But then since especially the beginning of January 22, we sort of shifted our focus to international research, because majority of the countries in the world had deployed these technologies, not only UK or not only Europe. And then we selected a cross-section of 34 countries. And then we started monitoring how those technologies were being used, the policies and practices around these technologies, and sort of like the important incidences that happen, such as repurposing health data or like surveilling people using these technologies. So we worked with a group of researchers and just followed academic articles, media news, government websites in order to create an overview of how these technologies were used, and sort of like ask the question of, have any of the identified risks and challenges with these technologies been materialized? What could have been done differently? And sort of what are the cross-cutting findings and lessons at an international level that we think that each country or society community should learn from the use of these technologies? So one of the I think most important findings is that, and questions is that, whether these technologies were ever effective. So probably this is like one of the most common questions that we get as the Ada Lovelace Institute. Should we use these technologies? Were these technologies effective for public health? And I think we should keep in mind that there's not an easy, straightforward answer to this question, whether they were effective or not, precisely because we don't have much evidence. So because governments rolled out these technologies at pace, they didn't even, I think about what kind of evaluation frameworks had to be in place in order to monitor the impact of these technologies. What we know from the available evidence is that some apps showed low technical efficacy. For example, the contact tracing apps in France, South Africa, and Australia. We know that in these countries, such as the UK, where the use was not mandatory in the sense that perhaps we needed to use contact tracing apps or QR score while entering into a restaurant, still we didn't get fined for not downloading NHS contact tracing app. People downloaded these apps, but then in time, the continued use was really low. Like, people didn't continue using these apps because they didn't find them effective. And of course, also for the UK case, NHS COVID-19 app showed some positive epidemiological impact, but no international comparison has been made. So we do not know internationally where the same contact tracing apps with same kind of technical designs, whether they have been effective or not. And I also want to note that even in the UK case, the same academic teams that advocated for NHS to roll out a contact tracing hub also conducted effectiveness and evaluation research. So we might say that there has not been any independent research in the UK as well. And as I have said, impact on public health is unclear because there was no effectiveness framework. But we know also that one of the most important issues is that these technologies were not well integrated within public health systems. For example, Brazil I gave Brazil as an example because there's quite strong evidence from there that. Okay, wow.
Big brother, big brother.
Okay. So they weren't well integrated within public health systems. What I'm trying to say with that is that someone.
I think it's someone speaking on.
Yes. I don't know.
Oh, you're making noises.
That was funny, but also kind of creepy. Okay, so they weren't well integrated within public health systems. For example, national or regional governments spend quite a lot of money on rolling out these contact tracing app, but then when people receive an alert that they have been exposed to someone infected, then they would want to get tested. And then that local authority wouldn't have adequate testing capacity. So they weren't well integrated. There was quite a lot of techno-solutionism, government just saying that rolling out these technologies and expecting them to be silver bullet and solve all the problems of the pandemic. And of course, another important thing is that there is no evidence on the impact on public health behavior. So we just do not know whether people found these technologies effective. We don't know whether they self-isolated. We don't know. We do not even know whether they downloaded these apps and then later didn't even check them or didn't keep them active. So there is no evidence on the impact on public health behaviors because governments, as we have said it multiple times today, is that there was not enough adequate qualitative research with members of the public, people actually who use these technologies. And with digital vaccine passports as well, we know that, for example, vaccines were effective in reducing hospitalizations and deaths. So we can perhaps say that digital vaccine passports were effective in that sense. They increased vaccine uptake in some countries, for example, France, where the vaccine uptake was relatively lower. And as soon as the government announced that they would use digital vaccine passports, people had to use it to go to restaurants or bars or workplaces. We have seen that people just were encouraged to get vaccinated. But then at the same time, we know that digital vaccine passports did not consider the reduced transmission because vaccines, there is some evidence that vaccines help with the likelihood of transmission, but getting vaccinated generally just protect us from getting severe symptoms. It doesn't decrease the likelihood of transmitting the virus. We know that black markets emerge for fake digital vaccine passport, for example, Romania, Italy, Nigeria. These are examples. Rather than getting vaccinated, people just paid for fake vaccine passports. And also we do not know, for example, whether the digital vaccine passports replaced non-digital health intervention, for example, community engagements to increase vaccination, these kind of stuff. And I am aware of time, so I'm just going to pass that. And I think public legitimacy and trust, this is something that we have been talking about today. This is in this map, you can see that these countries that are in orange color, these are countries in our sample where people just protested against digital vaccine passports and the restrictions they enabled. And the countries in gray color are just not in our sample. So more than half of the countries in our sample, we know that people just protested against digital vaccine passports. So this is just shows that governments just rolled out these technologies without clearly stating the purpose and the technical design and the laws and regulations around these technologies. And when it comes to impact on inequalities, we must say that there were some good policies and practices, because there were quite a lot of concerns around, for example, what will happen to the people who do not get vaccination? Will these people be able to go to work, or like, will they be able to travel? We see that with some countries, these were mitigated. For example, in the EU digital vaccine certificate, you didn't have to get vaccinated. Actually, you could also show your negative test result or like your immunity. But at the same time, we know that still quite a lot of groups face barriers to access and use. For example, in the UK, we know that, and this is not surprising, we have been talking about this all day today, minority ethnic communities were less likely to use these technologies. And qualitative research show us that they were less likely to use, some of them because they were less likely to get vaccinated, but also because they just didn't trust the government. I mean, for example, in the UK, the contact tracing app uses Bluetooth technology. So it means that it didn't actually literally track us. But then qualitative research shows that people thought that they use location data. So they thought that it just actually tracked them. So they were like, no, I don't want government to track me. I don't want government to know where I am. Which there were some contact tracing app that use location data, but not in the UK. So this is quite interesting. These groups were just like either did not use or like they couldn't use, especially like, for example, people who didn't have adequate digital access and skills. So they couldn't use contact tracing apps or digital vaccine passports, even if they wanted to. An amplification of global inequalities, of course, because especially digital vaccine passports facilitated this international regime that if we wanted to travel, we needed to show the proof of vaccination if we didn't want to get isolated. And we know that, of course, many countries, many low-income countries just couldn't secure adequate vaccine supply, or they just, or they couldn't encourage members of the public to get vaccinated. So this is definitely, I think this really links to one of the previous panels about securitization as well. So we just thought that those who were vaccinated were safe to come to our countries. And then we just like ignored people who did not have access to vaccination in many countries across the world. And finally, I want to very briefly touch on like governance, regulation, and accountability, because these technologies had to be, I'm of course not going to go into data protection regulations and things like that, but they just combine health information with very sensitive social or surveillance data. So they limit rights, and they should be proportional by striking a balance between limitations of rights, potential harms, and intended purpose. So it was essential that they were governed with strong, robust regulations, legislation, regulations, and oversight mechanisms. And majority of countries in our sample actually just governed these technologies in line with their pre-existing legislative frameworks, which were not always comprehensive. So robust regulations and oversight mechanisms were enacted in only a handful of countries. And unsurprisingly, because of the lack of robust data governance frameworks, there were quite a lot of like issues, for example, with the technical errors, data being reused for other purposes. For example, in Germany, which Germany actually has one of the most comprehensive data regulations in the world, police accessed a private contact tracing app data and used it in a murder investigation, a murder case investigation, which was totally against law, but then somehow police just could cooperate with the public health authorities to acquire the data. And in the US, for example, we know that the contact tracing app data was just sold to third parties, basically advertisement companies. And we just downloaded these apps for public health in order to protect ourselves and others. And such cases happen quite a lot, for example, with countries relatively weaker technical infrastructure. There were quite a lot of like hacking issues, for example, in Jamaica. In Brazil, actually, Brazil has a very comprehensive health, digital health infrastructure. Still, their system was hacked, and people's names and addresses, who were vaccinated people's names and addresses were revealed. And another important thing is that I think just is that many governments were reliant on private technology companies. So even the government launched companies had to either use Apple and Google's infrastructure, or their technologies just didn't work. For example, France's. So this is a very important thing, because I think we are in a moment where digitization of public services is like really fast, is accelerated. And then this shows the infrastructure power of these big companies that actually make the decisions of how a contact tracing app or digital vaccine passport should be designed and regulated, rather than governments. But we didn't elect Apple and Google, right? We elected our politicians, but yeah, still they got to make the decision. So yeah, we just like, these are like very high level lessons that I think we should learn. Still, we have quite a lot of evidence gaps, investing in research and evaluation, when using technology in public crisis, establishing what effectiveness might look like in advance and setting targets accordingly, creating specific guidelines and laws for emerging technologies, novel technologies, effectively communicating the purpose of health technologies and scientific evidence to the public. This is definitely something that governments like didn't do very well. Some of them tried. For example, Canada had this campaign with influencers telling people that they should like download contact tracing apps, but still we think that almost every single country in our sample could have done better. And finally, supporting marginalized and disadvantaged communities with strong public health services and social policies. Do not expecting the do not being so utopic and probably optimistic about the achievements of digital technology, and knowing that people like need still face-to-face communication, interaction, and public health services and social policies. So we have got only like 5 minutes, but I'm more than happy to answer any questions. But if not, I just wanted to ask your opinions of whether you think that these technologies should be used in future public health crises. Do you think that the infrastructure of these technologies and related regulations will persist in future health data and digital identity systems? For example, EU digital identity wallet would be an obvious one. And very important, those of you who actually work with people and communities, I would like to hear that whether you think that, or you have come across any data, any evidence, which would make you think that these technologies affected people's opinions and perspective of data-driven technologies, and if so, in what ways? Thank you.
Okay, my name's Des Blake. I'm from Newham COVID Champions. It was interesting what you said. I found in my community, local community, a lot of people did think the track and trace was actually tracing you all the time.
Okay.
Yeah, and
I thought that.
I thought that as well. Yeah, to tell you the truth.
I turn mine off.
Yeah, a lot of people did, just for that reason. So maybe they didn't inform us enough, but actually what it was doing. And can I just ask one more question? Do you think the government had to break or change a lot of their rules to break this out? Tracing.
Digital contact tracing, UK government.
Yeah. Did they have to change a lot of their laws?
No, I don't think so. No, they didn't, because they already had an existing, epidemics law that allows them to produce this kind of, but then at the same time, they do not have very specific laws and regulations for data protection or data-driven technologies for pandemics. So they use the pre-existing one, a lot of them, but now this is a very heated topic now, that whether we should have a specific regulation or like legislation around using data in pandemics, and the EU has been doing quite a lot of work on this actually.
Okay, thank you.
Yes, we had an NHS app already in the UK, didn't we?
Yeah.
Being encouraged to go on GP, NHS app, some people doing it, some not. I guess that was one issue for me, was that how did it relate to the NHS app? On my phone, still now, I've got one University College Hospital, I've got NHS app, I've got various COVID apps, and I'm probably not the only person. I don't like to put any information on those apps because I don't know how they connect with each other.
Yeah, you're right. There is not enough transparency around how our data is being collected and then how they're used. And unfortunately, also this is the case with even public health stuff.
Yeah.
They're not also in a position to inform us well. And actually, the UK government is now moving into a federated data system for health. So all our data will be on a we'll be able to share like nationally in a federated data system, while now it is like trust-based. So they're already moving into this direction that our data will be accessible to even more parties than it is now. But then as members of the public, I don't think that we are being informed as much as we should be.
I mean, you began your talk by saying it related to AI, but you didn't really talk about that. Are you suggesting that as these data develop, artificial intelligence is going to kick in some way? Is that what you're thinking about?
Yeah, of course. I mean, artificial intelligence doesn't exist without AI, without data. So data is the fuel of artificial intelligence. So it is very important that we think both together, but at the same time, with some applications, for example, China's health code system, it used people's data with an artificial intelligence. So it used various data to score the likelihood of someone's risk of transmitting the virus. So with some apps like artificial intelligence were integrated, but not so much in the UK and in Europe's case, I would say. Yeah.
So I just had a question on your point around the reliance on big tech companies. In the last talk I was just in, a former government advisor said that essentially one of the reasons why the UK app didn't work as they had initially hoped is that Apple turned off a setting in March 2020 that basically allowed you to pick up on Bluetooth connections or whatever, which meant that the UK app couldn't do what a lot of the things that they wanted to do initially, which is was going to feed into policy development and that sort of thing. So I mean, how should we think about the response to that sort of thing? Is it about government building its own systems that they can use instead of the big tech companies, or is it about government being able to, I guess, direct companies more about, exactly what settings they do open up to government and stuff like that? Is it more about sort of command and control or replacing them, or just trying to live within the constraints? But that doesn't seem great either.
This is a really good question. I wish I had a straightforward answer to that. In my opinion, I think for countries like the UK, the government definitely, first of all, needs to increase its infrastructural power, not to rely so much on companies like Apple and Google. And secondly, it should also recruit or work with people who actually have this kind of technical knowledge, because many civil servants do not have it. I used to work in civil service for a brief amount of time, and I was a digital person and I still didn't have it. So I think this is like one of the things to increase the capacity in terms of infrastructure, but also like just knowledge and skills. But this advice cannot be generalized at an international level, because what about authoritarian government having this kind of infrastructure? So actually in those countries, the narrative is very different. As people say that thanks to Google and Apple, who didn't allow the government to collect the data like the UK wanted to do, and thanks to them, the government just couldn't get access to our data, right? So for them, the narrative is very different. So for them, actually, perhaps, or especially for a section of those societies, perhaps like relying on Apple and Google is better or like equally worse than relying on government, right? So this is, but for the UK case, definitely, and also like just regulation. Now this is like one of the biggest things on the EU's agendas as well. How do you regulate these big tech companies? They have just gone so powerful that now we are thinking about how actually to sort of rebalance that relationship. Okay.
So what was you saying? So it's a matter of, in some countries, they trusted Google and Apple more than their government.
I mean, of course, I cannot generalize. These are just like the people networks that I have spoken to. But then yes, and I think we can all relate on some level that. But of course, this is with countries who were, let's say, relatively authoritarian, but still had quite a lot of infrastructure power, such as China. China didn't do what Apple and Google told them because they didn't have to. They have got so much power already. But in a lot of countries, for example, in Latin America or in African countries, or like relatively more authoritarian and countries in Europe, this was the case that like people like Ting, especially our experts, people who work in this area, were happier with Apple and Google's choice than the governments.
Okay, thank you.
Okay, great. Thank you so much, everyone. Thank you.